What is it like to live with arthritis? This question is more than just a curiosity. It's a doorway into a world that millions of people navigate daily. Arthritis isn't just a single disease, but rather a way to refer to joint pain or joint disease. It's a term that encompasses over 100 types and related conditions. Understanding arthritis is crucial, not just for those living with it, but for everyone, because chances are you know someone affected by it. We're going to delve into the world of arthritis, exploring its causes, symptoms, and the reality of living with this condition. We'll also discuss the various treatment options available, providing a comprehensive look at this widespread issue. Arthritis, though common, is often misunderstood. It's a condition that can drastically alter a person's life. But it's not a life sentence. With knowledge and understanding, we can change the narrative. Our journey to understanding starts now. Arthritis is not just one disease. It's a complex disorder that comprises more than 100 distinct conditions and can affect people at any stage of life. Let's dive into the world of arthritis, a condition that is often misunderstood and oversimplified. You see, arthritis isn't a single illness. Instead, it's an umbrella term that covers over 100 different conditions, all of which involve issues with the joints. These conditions are diverse and can impact anyone, regardless of age, lifestyle, or overall health. To understand arthritis, we need to talk about cartilage. This is the flexible, connective tissue in your joints that cushions the ends of your bones and allows smooth movement. When arthritis strikes, this cartilage breaks down and wears away. As a result, the bones rub together, leading to the symptoms we associate with arthritis: pain, swelling, and stiffness. Among the many types of arthritis, 3 stand out as the most common. First, there's osteoarthritis, the one you're probably most familiar with. It's the wear and tear type, frequently seen as we age, where the cartilage in your joints wears down over time. Then, there's rheumatoid arthritis, an autoimmune disease where your immune system mistakenly attacks your body's own tissues, primarily the synovium, a soft tissue in your joints that produces a fluid that nourishes the cartilage and lubricates the joints. Lastly, we have juvenile arthritis, a term used to describe arthritis when it occurs in children age 16 or younger. It causes pain and inflammation in one or more joints and lasts at least 6 weeks. Despite its name, juvenile arthritis can persist into adulthood. Arthritis is a complex and multifaceted disorder. It's not just an elderly person's disease, nor is it simply the result of aging. It's a collection of conditions that can affect anyone, at any time, in many different ways. From the young to the elderly, arthritis does not discriminate. The causes of arthritis depend on the form of arthritis. Diving into the depths of the matter, there are typically 5 main culprits to consider. First off, we have genetic factors. It's just like inheriting your grandma's blue eyes, only in this case, it's a predisposition to arthritis. Next up, there's injury. If you've ever had a significant injury to a joint, you're more likely to develop arthritis in that area down the line. Then we come to abnormal metabolism. This can lead to conditions like gout and pseudo-gout, which are types of arthritis. Fourthly, immune system dysfunction can result in rheumatoid arthritis and systemic lupus erythematosus, among others. Lastly, certain infections can also trigger arthritis. For instance, Lyme disease, caused by an infection transmitted through a tick bite, can lead to arthritis if not treated promptly and properly. While the exact cause might be unknown, several factors can increase the risk of arthritis. Arthritis paints a broad stroke of symptoms, often making it difficult to diagnose. It's a bit like a chameleon, changing its colors and forms, but there are telltale signs that we can look out for. The most common symptom, and often the first one to appear, is joint pain. This can occur in any joint, but is most commonly found in the hands, knees, hips, or spine. The pain often flares up during or after use of the affected joint, and in some cases it may be constant. Now imagine you've overdone it at the gym. You know that feeling of swollen, tender muscles the next day? That's another common symptom of arthritis: swelling. The affected joints may appear larger than normal, and the surrounding skin might look red or feel warm to the touch. Creaky, stiff joints aren't just a sign of a long day or aging, they could also point to arthritis. This stiffness is usually most noticeable when waking up in the morning or after a period of inactivity. It's like your joints have decided to hit the snooze button, even when the rest of you is ready to go. And finally, decreased range of motion. This is when it becomes difficult to move your joints as freely as you used to. Simple tasks like buttoning a shirt or opening a jar can become challenging. It's as if your body's own movement has been put on a leash. But here's the thing. These symptoms can vary from person to person, and even from day to day. Some days might be harder than others, but remember, you're not alone. Millions of people worldwide live with arthritis, and there's a community of support out there. So, if you're experiencing any of these symptoms, it's important to speak with a healthcare professional. They can help determine if it's arthritis causing your discomfort and guide you towards the right treatment plan for you. Recognizing these symptoms is the first step towards seeking help. Because understanding is the first step towards managing, and managing is the first step towards living a full and active life, even with arthritis. Living with arthritis can be a daily challenge, but it doesn't have to define you. Every day, millions of people around the world wake up to the reality of living with arthritis. It can be a struggle, but it's important to remember that you are not alone. Arthritis can impact daily life in various ways, from making simple tasks like opening a jar or climbing stairs more difficult, to causing discomfort and pain that can disrupt sleep and overall quality of life. But here's the thing. Living with arthritis doesn't mean giving up on the things you love or the life you want to live. It's about adapting and finding new ways to do things. It's about taking control of what you can and not letting arthritis take control of you. Making lifestyle changes can go a long way in managing arthritis symptoms. Something as simple as maintaining a healthy weight can reduce the strain on your joints, and regular exercise can keep your joints flexible. It's like the saying goes, motion is lotion. Exercise might seem intimidating, especially when your joints are aching, but it doesn't have to be. Gentle exercises like yoga, tai chi, or even just a walk around the block can make a difference. Physical therapy can also be an invaluable tool in your arthritis management toolkit. It can help strengthen the muscles around your joints, improve your range of motion, and teach you how to use assistive devices correctly. Self-care is another crucial aspect of managing arthritis. This includes taking prescribed medications, using heat or cold therapy to soothe aching joints, getting enough rest, and managing stress. Remember, it's okay to have bad days. It's okay to ask for help. Let's not forget the power of a positive attitude. Surround yourself with supportive people, celebrate your wins, no matter how small, and remember to take time for yourself. You are more than your arthritis. Living with arthritis might be tough, but remember, you are tougher. So take a deep breath, take it one day at a time, and keep moving forward. You've got this. While there's no cure for arthritis, understanding your options can help manage the symptoms. Treatment strategies can vary widely, tailored to individual needs and disease severity. First, we have medication. Over-the-counter pain relievers and anti-inflammatory drugs can help with mild symptoms. Prescription drugs, from corticosteroids to biologics, may also be an option, depending on the type of arthritis. Next, physical therapy. This can assist in strengthening the muscles around the affected joint, improving flexibility and reducing pain. Techniques can vary from exercises to heat or cold therapy, and even ultrasound treatments. In more severe cases, surgery might be considered. Joint repair, replacement, or even fusion can provide long-term pain relief when other methods aren't effective. Of course, lifestyle changes like regular exercise, maintaining a healthy weight, and a balanced diet can also play a crucial role in managing arthritis. Remember, the goal of treatment is to reduce symptoms and improve quality of life. Arthritis might be a common condition, but it's far from simple. We've delved into its complex nature, from understanding what arthritis is to exploring its causes. We've learned about the symptoms that can signal its presence and acknowledged that living with arthritis presents its own unique challenges. Despite these challenges, remember that there are a wide variety of treatment options available, ranging from medication to lifestyle changes, and even surgery in certain cases. It's about finding what works best for you, in consultation with your healthcare provider. While arthritis may be a part of your life, it doesn't define you. You are more than your condition. Remember to keep yourself informed. Be proactive about your health, ask questions, and seek help when you need it. So, keep learning, keep asking questions, and remember, you're not alone in this journey. Don't forget to like and subscribe for more informative content like this.